Hello, I am Dr. Yu from Seon Medical Center. I will introduce my paper published by Investigative Clinical Urology in March 2021. The title is Pure Laparoscopic Donor Nephrectomy Without Routine Drainage Does Not Increase Postoperative Morbidity. Since the late 19th century, routine insertion of a drain into an operative site has been considered to be a standard procedure. However, since the late 20th century, several trials have identified possible drawbacks of routine insertion of a drain. With the development of minimally invasive surgery, routine insertion of a drain after surgery has become increasingly questioned. There is a consensus that routine insertion of a drain is not usually needed after pure laparoscopic donor nephrectomy. In practice, even experienced surgeons may still insert routine drains after PLDN. The incidence of chylous leakage after PLDN has been reported to be up to 3.8%. In addition, the Swiss registry shows more major complications after PLDN compared with open donor nephrectomy. The Norway registry also shows an increased risk for a combined endpoint of intraoperative incidence, major complications and significant bleeding after PLDN. Therefore, routine insertion of a drain may be justified to detect early complications after PLDN such as chylous leakage or bleeding. To our knowledge, however, only limited information is available on routine insertion of drains after PLDN. In the present study, we sought to determine the feasibility to the omission of routine insertion of a drain after PLDN, comparing the outcomes between those with and without the insertion of a routine drain. A prospectively maintained database of 178 donor nephrectomies consecutively performed by a single surgeon, from July 2014 to October 2018, was reviewed. Since October 2016, we decided to omit routine drainage after surgery. The former 80 donor nephrectomies drained routinely were defined as the drainage group, and the latter 98 were defined as the non-drainage group. One patient in the non-drainage group suffered from massive bleeding due to an endoscopic stapler malfunction, and had a drain placed as a consequence. This patient was excluded from the final analysis. There were no significant differences between the drainage and non-drainage groups except for concomitance surgery, American Society of Anesthesiologists score, and preoperative glomerular filtration rate. There were no significant between-group differences except postoperative glomerular filtration rate. Mean time to removal of the drain was 3.4 days in the drainage group. Mean total amount of drainage was 437.1 ml in the drainage group. Mean postoperative glomerular filtration rate was significantly lower in the non-drainage group. The rates of overall intraoperative complications were similar in both groups. 18 patients in the drainage group experienced a total of 19 intraoperative errors, and 28 in the non-drainage group experienced a total of 32 intraoperative errors. The most common intraoperative complication was related to the adrenal gland. A total of 18 patients experienced 20 major intraoperative complications defined as grade 2 or higher. The rates of overall postoperative complications were similar in both groups. 50 patients in the drainage group experienced a total of 60 for postoperative complications, and 58 in the non-drainage group experienced a total of 70 postoperative complications. Nausea, vomiting, and ileus were commonly reported in both groups. A total of 5 patients experienced 5 major postoperative complications defined as grade 2 or higher. The rates of potentially drain-related postoperative complications were also similar between the groups. 29 patients in the drainage group experienced a total of 29 postoperative complications, including 2 major complications related to the drain. 32 patients in the non-drainage group experienced a total of 37 postoperative complications that were potentially related to the lack of a drain, including 2 major complications. In conclusion, The present study failed to demonstrate a clear advantage to either drain insertion or omission after PLDN. Based on the results of the present study not showing any clear disadvantage of drain omission, we have eliminated routine drainage in patients undergoing PLDN. Thank you for your interest in my paper.